Hello and welcome to the Stockport Virtual Ward. Our virtual ward was launched in October 2022 and is operated by Stockport NHS FT with technology-enabled support and monitoring from Tameside's digital health team. This video will highlight who we are, what we do and how you can refer to us in order to safely care for patients in their own home, freeing up acute hospital beds for those patients that need them. Hello, my name is Jane Etches. I am the service lead for the Urgent Community Response and the Virtual Ward team. We are a highly skilled multidisciplinary team consisting of extensivist GPs, ACPs, senior nurses, OTs and physiotherapists, and we are supported by therapy assistants and senior support workers.
Hi, my name is Karen Fern. I'm nurse consultant for community in Stockport. I'm going to outline the referral criteria for our virtual ward. Firstly, the patient should be registered with a Stockport GP. Their News 2 score should be 4 or lower, and they should have a stable or improving trajectory. Broadly, we have 3 referral pathways which are covered by frailty, respiratory and heart failure, and we're keen to develop further pathways. Things to consider as a referrer are the reason for referral and any treatment plan or investigations which you require. And this can include face-to-face home visit to obtain blood, for example, from our members of our team, and any parameters that you wish to set during that period of monitoring, for example, parameters for blood pressure, heart rate, oxygen saturations that are individual to the patient. It's also worth considering whether the patient is going to be able to manage the monitoring kit. If there are issues related to that, it's sometimes possible for us to overcome it, and you'll have the opportunity to speak with a clinician to discuss those individual factors and agree the best way forward for your patient.
Our Stockport Virtual Ward is supported by the Urgent Community Response team. Therefore, if you have a patient you wish to refer to the virtual ward, please contact the Single Point of Access team on 0161 204 4777. One of our clinicians will then assess your referral and its suitability. They will take the patient details and support the development of an escalation plan with the referrer. A letter will be sent out to the patient's GP to inform them that their patient is on the virtual ward.
Hi, I'm Lindsay. I work at Digital Health, currently based at Tameside Hospital, undertaking clinical reviews for the Stockport Virtual Ward. Our role in Digital Health is to virtually monitor patients with tech-enabled devices. Patients are boarded onto a platform on a variety of pathways. The team monitor the vital signs remotely and take actions as required.
The Stockport Virtual Ward is technology-enabled through the use of a Docabo device. This device enables the patients to insert their own observations, such as blood pressure, oxygen saturation levels and temperature, which help our clinicians to monitor the patient safely when they are at home and support decision-making as to whether a patient can be discharged or requires escalating for a review. We have several pathways for the patients on Virtual Ward, for example, frailty, acute respiratory and cardiac. The care planning digital health monitoring are specific to these conditions.
The Stockport Virtual Ward is clinically managed and overseen by a team of GP extensivists and advanced clinical practitioners providing 7-day cover. They offer a senior clinical review for all new patients within 24 hours of admission onto the virtual ward, and we have a team of Band 6 staff who monitor the patient's observations via the Docabo platform and have daily or twice daily telephone contact with the patient to monitor their progress during their episode of care. And they've got the ability to escalate any concerns or deteriorations to the senior team for assessment, which could involve a 2-hour response for a face-to-face assessment of the patient in their own home to determine next steps. In addition to the daily senior reviews of all new patients admitted to the virtual ward, we also offer a daily review of any patients who are escalated to the senior team because of acute deterioration or new clinical concerns. We also provide ward rounds which take place 3 times a week, where the patient has a more detailed review and a plan made for the remainder of their treatment, and look at the frequency and intensity of monitoring, any changes that are required for their treatment. Towards the end of their episode, we might reduce the frequency of monitoring to prepare the patient for discharge. Typically, we provide monitoring and support for a period of up to 14 days. As the patient becomes more stable and approaches discharge, we might reduce the frequency of the monitoring calls to prepare the patient for discharge. We'd look at any outstanding referrals or actions that are required and make sure the patient's fully aware of what the plan might be. We'd arrange to collect the monitoring equipment, and we provide a summary letter to the patient's GP via email outlining that episode of care.
For further information on the virtual ward and the urgent response team, please contact our single point of access on 0161 204 4777. Thank you.